Recording in progress.
We have a couple of guests today to give you some updates here late in the week. We're going to have, apologies. We're going to have Director Scott Bookman, our COVID-19 Incident Commander, and Dr. Ginger Stringer, our Epidemiology Response Program Manager, also here with us today. And we're going to go ahead and start things off with Dr. Stringer.
Good morning. As you can see, in the last several weeks, we've been seeing a sharp increase in the number of COVID-19 cases reported in Colorado. Next slide, please. We're also seeing a very sharp increase in our percent positivity, with it surging to above 15%, where we were down closer to 5% at the beginning of the month. Next slide, please. Both of these increases, along with some sequencing data from wastewater and clinical samples, as well as some other lab indicators, are making us fairly certain that Omicron is the prevalent strain circulating in Colorado at this time. Current data on Omicron is suggesting that it is more transmissible, indicating a higher risk that a close contact will become a case, as well as more likely to cause reinfection and vaccine breakthrough infection. There's still mixed data on how severe Omicron will be compared to other variants that we have experienced in Colorado, but we do have good confidence that a third dose of mRNA vaccines like Pfizer and Moderna provide the greatest protection against both infection and hospitalization. I'll turn it over to Scott to talk about hospitalization and testing.
Thank you, Dr. Stringer, and thank you all for joining. To the members of the media, I do want to wish you a happy new year. Thank you for all of your work in helping us communicate this critical information to the public over the course of 2021. Unfortunately, our hospitalizations are beginning to increase. You can see that over the course of much of December here, we have had a decreasing trend. Over the last several days, we have seen that trend begin to reverse itself. As of today, we are now at 1,088 people hospitalized with COVID in the state of Colorado, and you can really see how sharp that increase is looking as of today. On the next slide, we'll give you a quick update on where we stand in our overall hospital capacity. The blue bar graph here shows our daily hospitalizations for COVID. You can see again the beginning of that increase in that blue bar graph. And then the orange line is our 7-day moving average of total acute care hospital beds available. That number continues to hover in that 500 to 600 range, depending on the day. And so we do still see an incredible amount of stress in our healthcare system as we continue to move through what is clearly the Omicron surge here. Next slide. So one of the most important tools that we have at our disposal to limit the spread of COVID-19, including the Omicron variant of COVID-19, is testing. And so we have done all that we can to make sure that testing is widely available across Colorado. We have more than 150 community testing sites available. We do know that there has been an increase in demand at testing sites in Colorado, in testing sites across the country. And we really do strongly recommend that people go online, look for locations and scheduling information using our COVID-19 website. And we really do want to make sure that people are taking the opportunity to make advance appointments when possible to decrease their wait times. Additionally, we will have sites closed on New Year's Day, and we do want to make people aware of the fact that there is some pretty severe weather coming into the state and coming into the Denver metro area tomorrow. And so for anybody who feels like they need to get a test tomorrow, we would really encourage people to go early before that weather comes in and has the ability to impact travel and impact our ability to operationalize these outdoor testing sites. Next slide. And so not only is testing a tool, but we know that vaccine is the tool. And so what we have done is we have created community vaccination and testing sites to ensure that people have access to these two key resources in one place. And so on the screen here are our community vaccination and testing sites: Dick's Sporting Goods Park, Waterworld in Federal Heights, Kunzmiller Creative Arts Academy in South Denver, the Timberline Church in Fort Collins, and Vail Health. You can find information about these sites and many of our other sites on our Colorado COVID-19 website. It is never too late to get vaccinated. It is never too late to get your third dose of the mRNA vaccine if you're eligible. So anybody who is more than 6 months out from their second dose of their mRNA vaccine, or more than 2 months out from their Johnson & Johnson vaccine, it's time to go get that booster now. It is never too late to do that. And as we see increasing cases, the more protection we have, the better off we will all be. Next slide. And I'll turn it back over to Brian.
All right, apologies for that issue with my mute button. Thank you, Director Bookman and Dr. Stringer. We'll open things up to the media Q&A portion of this morning's press conference. A couple of notes here. Let's use the raise hand function at the bottom of the Zoom console. We'll go ahead and start with first questions first. If we have some time at the end, we can circle back for follow-ups or second questions. Please state your name and the outlet that you're working for before you ask your question. And then a reminder too that if we aren't able to get to your question or unable to answer it today, please do email us at media_info@state.co.us and we'll get your response as soon as we can. Let's go ahead and start with Meg Wingerler.
Hello, this is Meg from the Denver Post. I wanted to ask, with the number of cases we're seeing, but also the kind of mixed data on severity, do we have any sense of what we might be over the next few weeks in terms of hospitalizations or how much strain they might be under in the near future?
So Meg, I'll try to answer that question for you. I think the top line message is we just don't know right now. Omicron is obviously the newest variant that we have. We're trying to gather as much information as we can from other countries that are ahead of us, even looking to other parts of the United States, the East Coast, New Jersey in particular, where they have seen a significant rise in cases. At this point, we have not seen massive stress on the hospitals in those areas, but I would also say that it is too soon to know what is going to happen, and we're going to keep watching all of those other areas that are ahead of us to understand the potential impact.
All right, let's go to KDVR Digital. Go ahead.
Sorry, guys, it always takes me a bit to unmute. Appreciate you holding this press conference. I want to get into monoclonal antibody treatments. We've seen notifications from UC Health saying there's a shortage. They're no longer allowing just anybody to sign up. They're really just rationing the supplies to the extreme at-risk populations. Also, just looking at the state system for the buses that bring those treatments to different communities, a vast majority of those buses have 0 appointments available. I'm bringing all this up because just about an hour ago, 2 hours ago, CDPHE tweeted out from their Twitter account, if you test positive for COVID after your holiday gathering, you may be able to get monoclonal antibody therapy. Why is the state advertising a treatment that's widely unavailable to the general public right now in Colorado? And is the state getting any more of this treatment in from the federal government? Thank you.
This is Scott. I'll take that question. So, monoclonal antibodies are a very specific type of treatment. And what the research has indicated is that there is only one monoclonal antibody that is now effective against Omicron. And so all monoclonal antibodies are allocated at the federal level to states based on their population. And so with all of those other treatments no longer being distributed, we have an incredibly limited supply of monoclonal antibodies in the state of Colorado. We went from receiving 4,000 to 5,000 doses per week. Now we're receiving somewhere closer to 300 to 400 doses per week to serve the entire state. That is obviously an incredibly limited supply. We are still providing this information to the public because we want to make sure that everybody knows that this important treatment is available, and they need to find out if they qualify for it, and they can contact their healthcare provider to do so. We understand that there'll be frustration. It's difficult to get, but those who are most vulnerable still need to know that it is a medication that they can access, which has great efficacy in preventing hospitalizations.
All right, let's go to John Ingold. Go ahead, John.
Hey, John Ingold from The Sun. Thanks for taking our questions. Do we have any sense of how COVID case numbers are impacting hospital staffing? Or are we seeing, I noticed that something like 50% of hospitals are anticipating a staffing shortage. Is that related to COVID cases among their staff, and how widespread is that?
John, I'll start by just thanking all of our healthcare workers and first responders on the front line, who we all owe an incredible debt of gratitude for their work over what is now almost 2 years of this pandemic. Omicron is growing rapidly. We know that people are getting infected in all walks of life, and it is impacting our healthcare workforce. We are in constant communications with leadership of hospitals across the state, doing all that we can to understand the stress that they're feeling, making sure that our transfer center is ready to support movement of patients when bed availability becomes challenged. I don't have any specific instances that I am aware of as of today where we're seeing a true drastic impact on the hospital's ability to take care of patients because of Omicron cases within their workforce.
All right, let's go to Bo. If you could state your name and outlet, please.
Thanks. Bo Baker, KUNC Community Radio for Northern Colorado. I'm wondering, with new CDC guidance on shorter isolation times for asymptomatic cases, there's been a mixed response. Where are Colorado health officials in this? How are you looking at this new guidance?
So I'll start by saying it's new guidance, and we have asked the CDC for clarification, as many others have done, to ensure that we understand exactly what their intent was. But what we know is that the CDC is working off of the best evidence that they have available to them about the vast majority of transmission happening early in someone's illness, and the CDC is really trying to balance appropriate isolation and quarantine guidance with the need to maintain our critical workforce.
Okay, let's go to Drew Smith.
Yeah, hi, this is Russell Haythorne with Denver 7 News. I'm on my photographer Drew Smith's computer, but I'm curious, you mentioned a rise in Omicron cases, and you also mentioned the weather moving in this weekend just in time for New Year's Eve. Many have plans tomorrow night, obviously, and many of those plans will likely be indoors with a major winter storm moving in. So I'm curious, are you advising Coloradans to change or cancel their indoor plans given the sharp rise in COVID cases? Or is vaccination plus testing enough to ensure safety of large crowds gathering indoors this New Year's Eve?
So we're 2 years into this pandemic now, almost, and the basics of infection prevention are still the same. Number one, if you're vaccinated, and you've received your third dose of your mRNA vaccine, you are as safe as you can be. We know that if you limit the size of your gathering, if you ensure that you have good ventilation in your gathering, if you know the vaccination status of everybody who joins you, you will be safer. So smaller groups are safer than larger groups. Obviously, everybody being vaccinated and having received their third dose is safer than not. Trying to get testing before you gather, these are all tools that allow people to gather in the safest way possible.
Okay, let's go to Marshall Zellinger. Go ahead, Marshall.
Hey there, Marshall Zellinger, 9 News. Given the positivity rate climbing, and you can tell me if it's an abnormally high or low number based on how many people are getting tested now. But as someone who I'm assuming is fully vaccinated and boosted, are you comfortable dining indoors? Are you comfortable going inside and attending the National Western Stock Show?
I am. I have been living my life to the best of my ability. I mainly work from home. My internet did go out this morning, so I had to come to the office to do this media availability with you all. But I am careful in my interactions. My family came over to celebrate the Christmas holiday, and we celebrated outdoors. But we do go to restaurants. We may or may not attend the National Western Stock Show. Individuals need to make their best decision based on their own personal risk profile. But again, the vaccine is the absolute key to keeping you as safe as possible. Wearing a mask when you're indoors is another key tool here. And of course, if you're sick, don't go out. Get yourself tested, stay home. We need to be in this together to protect ourselves.
Let's go ahead to Jaleesa. Go ahead.
Jaleesa with 9 News here. Pitkin County has seen a 2,000% increase in positive cases in 14 days, and Summit County isn't too far behind. What's your message to these mountain counties expecting an increase in visitors in these coming days?
So we are working with our mountain partners, just as we work with our partners along the Front Range and on the Eastern Plains. COVID has spared no county in Colorado over the course of this pandemic. We are doing all that we can to provide our mountain communities with all of the information and technical assistance that we can give them. We're providing testing resources as available and making sure that we are here to support their healthcare systems as they see this potential surge in patients.
Let's go to Nicole Brady. Go ahead.
Hi, Nicole Brady from Denver 7. With school starting again next week, I'm wondering if you're seeing cases of Omicron behaving any differently or any COVID cases that come in right now among kids, and what the latest vaccination numbers are for 5 to 11-year-olds in our state.
I think I'll defer to Dr. Stringer on what we're seeing in the pediatric population.
Yeah, hi. With the sharp increase in cases that we're seeing across Colorado, we are seeing in all age groups. We still have the highest rates among the 12 to 17 and over 18 age groups, but we have seen sharp increases in cases among the younger children as well. I don't have the 5 to 11 vaccination rates handy. Scott, do you have those on hand?
I do. We are now at 30.5% of our 5 to 11-year-olds having received at least their first dose of the COVID vaccine.
All right, let's go ahead to Seth Kleiman.
Hi, Seth from the Gazette. As far as trajectory looking forward of this surge, it seems there's some evidence elsewhere that Omicron burns so hot, and that means the peak will come sooner. Is that sort of what you're projecting? Do you have a sense of when Colorado might hit its Omicron peak in the next month or so? Thanks.
So I think it's a little early to try to predict that. We are looking at what other parts of the state or what other parts of the country and other parts of the world have seen. We're obviously moving up at a very fast rate. And what we have seen in other places is when you go up fast, it also comes down fast. But I do think it is too early to begin predicting when that peak may occur.
All right, let's go ahead to Shannon Young.
Hi, Shannon Young from KGNU in Boulder. I'm wondering if there is a situation going on with the at-home testing kits ordered through the state. Several people have mentioned that they've had no prior problems with getting them delivered before, but since Christmas, they just haven't arrived.
Yeah, in Colorado, we were the first state in the country to build this over-the-counter testing program where any Coloradan could go on and order a test and have it shipped to their home. And we're thrilled that so many Coloradans have taken advantage of this program since its inception. Unfortunately, there is a national shortage of available tests. Our team is doing all that they can to work with Abbott, who's the manufacturer of Binax, to try to get more tests from them. We simply don't know if they have any available. We are all looking at other potential testing supply vendors to see if they have any tests available. Again, this is a national problem, and we are working with the private sector and with our federal partners to get as many tests into the state as we can.
All right, let's go to Meg Wingruder.
Hello. My second question is, we've been hearing anecdotal reports of people being turned away at testing sites or running into difficulty with those. And do you know overall issue with capacity, or is this a bit more isolated in terms of, certain sites are very popular and others are not getting much traction?
Great question, Meg. And really, we have more than 150 community testing sites available across the state. We have heard of isolated incidents of extreme delays at some of these sites. And this is why we really want to encourage Coloradans to go on our website and identify, maybe several testing sites that are closest to where they are so that they have a backup plan. Also really want to encourage people to make an appointment if it's a site that takes appointments. And we are doing all that we can to continue scaling our testing capacity at this time. And I do want to just take a moment to really urge all Coloradans and remind everybody that we're in this together. We know that when there are delays, it can be frustrating. We have heard reports of people treating the staff at our testing sites poorly, and really just want to just say to everybody, we're all in this together. We're working as hard as we can to keep everyone safe, and really urge everybody to just work together if you encounter a line at a testing site.
All right, KDVR Digital.
Hey, it's Alex again with Fox 31. Just bouncing off that, and I kind of know the answer to this question given your last response, Scott. Obviously, the people at those testing sites are working really hard, but given the fact that this is such an important time of year and the demand is so high, has the state reconsidered closing them all down this Saturday for New Year's Day? I'm sure those folks need a break, but at the same time, the demand is just so high that that's got to be an issue.
Alex, it's a great question. We are looking into all possibilities to make sure we have as much access as possible. We are reevaluating what we could do on New Year's Day. And as any additional resources are available, we will make sure that it's on our website, that the public knows about it. We know that the demand is there, and really trying to scale as rapidly as possible as we've seen this big increase in demand in the last few days.
All right, John Ingold, go ahead.
Thanks. Another question for Scott here. This one about hospital bed numbers. When I look on the hospital bed use charts on the dashboard, it appears that the number of acute care beds, or at least the number of staffed beds in the state and the number of ICU beds is continuing to decline. It's down even a little bit since November. So what's causing that, and what's the update on the effort to add more beds and also to help hospitals with staffing?
So John, I think a couple things about the data on the dashboard. First of all, our hospitals are always reevaluating the numbers that they post based on real-time information. And so those numbers will go up and down, depending on what the hospitals themselves see at any given moment. We do know that healthcare workforce is burnt out. People are leaving the profession. There are staffing issues associated with people leaving the profession at this point. And so we are continuing to work to add beds across the state. We have, as of today, we've provided staff, over almost 200 staff members to facilities across the state. This includes long-term care facilities, so that we can move people out of hospitals into those long-term care facilities, opening up acute care hospital beds. Additionally, we've had federal teams come in to increase our capacity at some of our hospitals, and we continue to evaluate any additional staffing resources that we can bring in, both through our contracts and through federal partners, to ensure that we're creating as much capacity as possible.
Right. Thank you to Director Bookman and Dr. Stringer for joining us today. And thank you all for joining us. If you have any questions that we were not able to get to today, please email us at media_info@state.co.us. And with that, hope you have a good rest of the day and a safe and happy new year.